I'm so excited to be here, and I have a few questions for the audience to get things started. I'd like to get a few key words about why you're here. Why are you here?
Inspiration.
Inspiration, that's great. To learn. What else?
To meet new people.
Meet new people. Network. That's great, because I think that's so important. I think really as we bring new interventions, new assessments, new interactions, new everything out, we have to do it together, or else it's going to be done in a inefficient and complex and maybe boring manner. So I've been so inspired by some of the talks I've heard today. I'm sure you have been too. Well, for my talk, which usually lasts about 45 minutes, I'm going to skip every third word. So you need some hand signals to keep me on track. Please, if I'm going too slow, go like this. Please, if I'm too boring, go like this. And if I'm not speaking loud enough, go like this. And please grab me in the hallway, especially if you don't agree with anything I've said. I'd love to have some debate and controversy. My goal now is to give you a bit of an overview of all the amazing things that are going on in the medical VR and healthcare arena. And there's a lot. And my goal is also to try and entice, enthrall, cajole, seduce, bring more people into jumping into this area, because I think it's so important and it's so exciting and there's so much going on. I think you would enjoy joining us if you are in a position to do so. I have a number of academic affiliations which are fantastic for understanding the basic research that we need to bake into the products we build. But what's really getting me excited right now are the various startups that are out there. Here are a few that I'm really proud to be associated with. And it's just so exciting to see so many great companies come into the medical arena, bringing in new digital health and new AR and VR technology. For me, what's driving a lot of my passion is the fact that there is a crisis looming that we need to move on now. And of the many things we could be worrying about as a culture, it's the last one on the list, the healthcare crisis engendered by an aging population, that I think we really need to pay more attention to. Since the 1960s, the US population has doubled, but family size has gone down, so we're very top-heavy. We have so many of the aging boomers going into their 70s, 80s, and 90s, and not enough caregivers to support them. The only way out is to leverage technology. And fortunately, there's a digital health revolution going on right now with mobile health and e-sensors, a lot of amazing things going by, wearables that we can bring in, leveraging the internet, leveraging storytelling and gaming technology, and bringing people together in a new way of personalizing healthcare. Every medical device has moved over from an analog world to a digital world, but in addition, we're coming up with new ways of capturing blood chemistry, heart rate variability, electrodermal response, in ways that are not invasive, that we can collect 24/7 important biomarkers that will help us personalize healthcare. And that's going to be a theme of my talk today, is how can we personalize healthcare so that it is precise for the individual as opposed to an algorithm one-size-fits-all approach, which by and large has been what we've been constrained without the informatics that we have now. And it's not just the things we wear and the things that we measure that are part of this revolution. There's new ways of measuring things being developed all the way. Voice analytics, for example, to score anxiety and depression and pain as a biomarker. Capturing facial expressions, again, as a biomarker of cognitive state. Using AR technology to do a cognitive assessment for neurodegenerative disease, for example, where we're able to predict sometimes 5 or 6 years in advance the probability that someone's going to convert from mild cognitive impairment over to Alzheimer's disease. This is really important because these measurements not only will help us do a better diagnosis, and especially understanding the emotional state of the individual, which so far previously has been mostly a subjective report type of situation, but to also understand what's the right treatment for the individual. So this is probably the most important slide of my talk, the fact that we now have ways of analyzing a large amount of individual and population data in the cloud using machine learning and other AI aspects, but connecting the payers, the clinicians, the the people that are developing the technology to that anonymized data, and then more importantly, and this is where many of the people in this room come in, having a way to have something that interacts with the patient, to engage them in their therapy, and to measure their status more accurately. And it's not just AI and machine learning and wearable sensor technology that's driving this. A lot of the work that's going on in developing avatars is really moving along pretty fast. And I'm so excited to see that we're using better, more realistic looking avatars as part of the training process for clinicians, and also as a substitute when things are backed up or when we have trouble reaching a patient population, to have an avatar that resembles your clinician be able to answer questions for you basically after you have a medical problem, or maybe preventatively in advance. And there's some other tricks and techniques we can use to leverage the fact that we're now getting much more realistic avatars. I don't have time to show the clip from this, but this is an avatar developed by a company named Oben, where they capture your facial expressions and your voice tones, bake it into your avatar that looks like you and sounds like you, but your avatar can speak in another language or can sing and dance, even if you can't sing and dance. It's really quite amazing what's happening in this arena, and it applies directly to some of the things that we want to do in healthcare to engage the people. And again, later in my talk, I'll talk about how we leverage avatar technology to establish empathy for our future self and use this as a way to help us understand what the decisions that we make, how they affect our healthcare. So see how happy this clinician is? This is the future, leveraging medical applications of XR technology. And it's really coming along pretty fast. The analysts project that medical VR, and I tend to say VR when I mean the full spectrum of immersion technologies, just out of habit. The analysts tell us that it will be a $5 billion market in the next 7 years. And the reason for this is that the pharma companies and the medical device companies are finally realizing that they can do combination therapy of their technologies, their pharmaceuticals, with the emerging digital health technologies, and then how powerful AR, VR, XR technology is used in combination. So it's a very exciting time to see this. For me, personally, it's very exciting because back when I had more hair, back in the 80s is when I got involved. And back then, the headsets were so heavy, we had to counterbalance them with a brick. The computers were very expensive, and the graphics looked like they were from the movie Tron. But the technology worked, and we were able to do effective medical interventions, even back in those days with the expensive, limited technology. And many research groups, many of my colleagues have spent their careers developing and pioneering new pathways to use VR and AR technology in a medical situation. Now, the technology is just now escaping from the research lab. And what's my point of telling you about the history here? Well, we have a large amount of data already collected showing the pathways that are worth pursuing. Now we need to revalidate that data, move it out now using current technology, but we know what is the right pathway to go down, and we can leverage the very strong, powerful technology that are coming out right now to go down those same pathways. Right now, there's more than 160 different clinical zones 20 clinical zones and more than 160 emerging medical tech companies active in this arena. And this is probably an out-of-date number. There's so many startups jumping into this area and coming out. And I'd like to, if you're interested, I'd like to call your attention to the International Virtual Reality Health Association. Bob Fine, the founder of that organization, is with us here today. And it's an industry association bringing together the people who are participating in this ecosystem. And Bob is organizing 3 conferences over the next year, one specific to VR and behavioral health, mental health in Denver, Colorado, one in Dublin, Ireland, and then one at Vanderbilt University in the spring. If you're interested, this would be a great way to get involved. Okay, so why now? Why is VR finally crossing over? If we were able to have effective interventions previously, why did they not move forward? Well, part of it was the cost and the comfort of the technology, but also I think our culture is getting a little more socialized. VR doesn't seem like such a strange and weird thing now. And again, the medical product companies, the pharmaceutical companies are jumping in. So I don't have time to go into detail right now about this, but I wanted to emphasize that it's really the full stack of clinical care that is being profoundly affected by this. starting with prevention and wellness, better assessments and measurements of physical movement and cognitive function and emotional state, better functional training of how to do a surgical procedure or a collaborative procedure in a hospital, improved interventions, better treatments, ways to facilitate adherence, sticking with the program, and ways of reaching underserved populations. So just very briefly, all aspects of training have been impacted by this. There are some medical schools now that don't have cadavers. They use an all-electronic cadaver. Skill training of how to learn the soft skills of interacting with a patient, and also very important, practicing working as a team to handle an emergency or a complex procedure. Cities and counties are practicing in simulated environments how to respond to an emergency, getting everybody to work together as a group and doing an after-action review of what happened during the procedure so they can refine it. And again, you've heard today how VR is very effective at helping understand the patient experience and develop empathy. Of course, anatomy and physiology training can be done much better than dry textbooks or videos, but we can also do very impactful surgical training. It used to be you had to fly to a simulation center where a multi-million-dollar knee simulator might be what you practice on to learn a procedure. But now, very effective systems can be used at your hospital, at your clinic to learn a procedure. And it's not just learning the procedure in-house on your own. I've seen great collaborative systems where people log in from all over the world to practice together on how to learn a complex procedure. The medical device companies are getting involved, and instead of spending a lot of time training people and then having them forget their skills and needing to remember it in the moment when it is time to use that particular device or do that particular operation, you can practice right beforehand in a simulation. We have virtual patients that a learner can talk to, interact with, to learn their patient history. This is very much more effective than waiting until you have access to work with an actor or an actress. And we have fantastic systems for team training. Todd Chang from UCLA will talk tomorrow about pediatric resuscitation and how they use a system that is required now for all new people who work at the Children's Hospital of LA in the pediatric emergency department need to go through the training before they're allowed to work there. We can prepare for giving difficult conversations about unpleasant things like a terminal illness or a family member's prognosis. And again, we can show the patient experience, the patient journey very effectively to clinicians. We can plan an operation in advance by data fusing all the information we collect, and for complex procedure, practice it the day before and the day of the procedure. And it's not just the training that's being impacted by this, and this is, I think, really exciting. The diagnostic assessments, many of them that we've had in the past have been hard to capture, hard to analyze, and very subjective. But we can do neuropsychological assessments, measure movement for simulations of activities of daily living. We can facilitate physical therapy and occupational therapy. And in behavioral medicine, we finally move from an area of self-report to something that involves an objective assessment of somebody's cognitive function and mood state. I'm excited to see that we now are starting to develop rooms that you can step into to have an experience and design that as a quest or a task or a process, not just for assessments, but also as a therapeutic intervention to do behavioral activation therapy, for example, for someone who's depressed. Now, many of you have probably had your first experience, I think it's sort of a cheap trip that they do at many laboratories, of getting up on a plank and being asked to walk out and rescue a kitten. And the reason we traumatize the visitors to our lab like this is that we want to show the fact that we can create an emotional state. And if you can create an emotional state in a person, you can also help them learn how to manage that emotional state. It's a very effective way, and I'll talk in a moment about exposure therapy, but it's a very effective way of helping people who need to master their anxiety, master their mood swings, the skills they need to measure that, by being, or a phobia, for example, by being able to do exposure therapy. This also puts us in a position to come up with new ways of doing a cognitive assessment, something that is very difficult to do and time-consuming otherwise, and not always that realistic. And one of the things that I'm very excited about is how this allows us to do precision medicine for treating complex problems like depression. For example, here's a brief talk by my colleague Lee Williams about how we can do precision medicine in depression using VR and AR technology.
Cancer has been known as the silent killer. It grows inside a person, often undetected and unseen. Just like cancer, clinical depression often grows undetected and unseen by themselves and by their loved ones. The sufferer blames themselves for their depression and hide it away. Depression can lead to a loss of hope, a loss of talent, and a loss of one's job. More people die from suicide caused by depression than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, and lung disease combined. Sadly, in the next few minutes, another American will kill themselves because of depression. Imagine for a moment the entire population of the United States. That's well over 300 million people. Around the world, there are more than 400 million people that suffer from clinical depression. To find a cure for depression and ultimately prevent it, we need to look at it from an entirely new perspective. Depression is not something you get like a cold. Depression originates from the brain. Imagine we're able to observe the brain directly, peering into the inner circuitry of the brain. Just like there are different types and stages of cancer, there are also different types and levels of short circuits that cause depression. We also see levels of these short circuits in people at risk for depression before the illness becomes full-blown. No two brains are the same. One brain might respond to certain medications and therapies, but another might need a whole new treatment. By precisely identifying the type of short circuit in the brain, we can design customized treatments and preventions to target that specific short circuit. With the help of machine learning and big data, we can create and evolve customized treatments and preventions for every type of brain. This radical shift in how we look at depression, the brain, and targets for treatments and prevention can mean healthier lives for everyone. All of this may sound a little science fiction, but at PanLab we are doing just that.
This is just one example of how precision medicine is coming out right now as a better way of matching treatment to the individual. And immersive environments are a big part of that for both the assessments and for the interventions. In the project I'm doing with Lee Williams, we're capturing images of the brain and establishing what those neurocircuits are for different biotypes of depression. But we don't want to have everybody go to a medical imaging device. They're too expensive and not very common in order to be diagnosed and understand the different biotypes. So what we're doing is we're doing a study where we're correlating the data that we get from the machine, the imaging machines, with the reaction to different challenges in the virtual environment. And we're also collecting real-world data about behavior using activity levels and cognitive assessments that we do for people who opt in onto their cell phone, how fast they're swiping, how fast they're typing. So we get behavior data and we get the response to a virtual challenge to identify those biomarkers, individual biotypes that can help diagnose depression, and then send people down the appropriate clinical pathway. It might be a different medication, it might be cognitive behavioral therapy, it might be something completely different, but the ability to match the right therapy to the individual is engendered by this new technology that we're doing and the project that we're collecting. And one exciting part of the project I'm really excited about is we're collecting a database of different virtual environments that we're studying the response of individuals to come up with a library of publicly available emotional stimulus environments so that we have culturally specific, age-specific ways of inducing different moods to study those brain circuits. So that's a project that we're actively looking for collaborators on. We will, in addition to collecting the subjective response to those environments, we'll be collecting objective biomarkers and psychophysiology to come up with a publicly available library of VR environments that can help trigger a cognitive state for both research and for clinical care. And one of the things I'm excited about is the evolution of using inserts into the HMD so we can capture facial expressions. I think there's a lot of information there that we can collect and use. So we can use systems like this for better assessments for attention deficit, as an example. I'll give you some other examples of how VR is being used clinically. For physical therapy and occupational therapy, groups like MindMaze are developing systems that can be used both for the acute phase of stroke rehab, but also go home with the patient for the post-acute phase. And again, using our big data analytics to personalize the therapeutic pathway for the patient based on their individual injury to the brain. We all know how VR is being used very, very powerfully to help as a distraction from uncomfortable procedures or painful procedures. I think the things that are going on in mental health are particularly important because we're so backed up that sometimes people decide to make that phone call because they are having a problem with depression or anxiety or with addictions, and they're told their appointment will be in 3 months. So we can use VR assessment technologies as a way of assessing who should be at the front of the line. VR is being used very effectively right now, clinically, to treat post-traumatic stress disorder, phobias, and anxiety disorders. But we also use it to help with treating addictions as a way of allowing people a place to learn and practice refusal skills and situational confidence. Social anxiety disorder, depression, mild cognitive impairment, autism, attention deficit disorder, phobias, anger management, eating disorders, schizophrenia. There's a very long list of where VR is being used right now clinically. It has escaped the research lab as being used in clinical practice. But of course, these are the early adopters. I think with further improvements to the interventions and further validation studies, we'll be able to push it out. So of course, the health and wellness is impacted by this. And of course, the fact that we can do mobile VR systems allow us to reach underserved populations like a telemedicine manner. Let me skip a little bit. Oh, okay. One thing I'm really excited about is that the drug companies, the medical device companies are appreciating that VR and AR is an important part of the platform for doing combination therapy, that they can measure the effectiveness of their interventions by using a VR platform as an assessment system. Very quickly, I'm going to talk about the neuroscience of why VR is working in such an impactful way. Right now, we use VR, and we know it can activate neuroplastic changes because it stimulates the reward system, shortens the feedback loop of seeing the choices that you make, and it leverages the mirror neuron systems. One of the projects we did at Stanford was capturing an image of an individual and then age progressing it. And then we have the individual get to know their future self, talk to their future self, and interact with their future self, and get feedback from their future self about how their behavior changes things. And we can push this out to, in a transmedia way, to other ways of intervening. Your future self can call you up if you go into a bar and say, hey, we talked about this. You remember you were going to cut back a bit. And more importantly, we can use the biosensors and other data that's in the environment to come up with a digital twin that changes dynamically based on your sleep, based on your nutrition. Digital twin technology is being developed, for industrial process regulation, but it's also being developed for human health records. So our digital twin can show us what the effects of our sleep, our eating, our socializing, our activity levels, our nutrition, our medications, how they're affecting what our future will be like. And this closing of the feedback loop and the mirror neuron systems involved behind having empathy for yourself is a very powerful way to shift behavior. And one of the other reasons that AR, VR, XR technology is so important to the medical healthcare system is it allows us to build a narrative story around the intervention. Instead of just taking a pill, instead of just getting an injection, instead of just measuring a temperature, we can have a story built around you, your priorities, your health goals, and see how it affects you, your prospects for a healthy life dynamically. And we can put that in a variety of forms, leveraging the power of storytelling. Okay, to summarize, I really think all we have to do is do the math. We know that in 10 years, 15 years, we're going to have a huge economic disaster and a healthcare crisis unless we take action now. And fortunately, the digital health revolution, I think, was if we jump in now, put in some hard work, we'll come up with the interventions we need before that care crisis peaks. And many of the things that I talked about today map to addressing the problems in senior care. improved assessments, addressing chronic and acute pain, physical and stroke rehabilitation, designing for disabilities, following up on a patient with a virtual avatar of the clinician to ask and answer questions, and then again, helping people understand and be empathetic to the people that are going through the disease process, and also reducing senior isolation. So I'm excited. I think that it would not be accurate to say that we've made the transition of moving safely all the potential of VR and AR and XR technologies out into the clinical world. We are working with the early adopters now, and it's showing great progress. But we're poised to move forward faster. And again, I'd like to entice and seduce and recruit the people in this room to help join this journey. And thank you for the opportunity to give this presentation.